1 in 6 children across the globe is likely to have a neurodevelopmental disability. The global prevalence is significant, and the associated burden impacts families in every region of the world. To understand these conditions, we have to look at the brain's developmental period. While structural growth continues into the mid-20s, the brain undergoes its most intensive physical progression during the first few years of life. When this development deviates from the typical path, it results in a condition with a neurological onset. The brain is effectively wiring itself differently as it unfolds. This primary node triggers a cascade of difficulties, impairing the child's self-care, social, and academic functioning. This baseline signals further risks: a 6-fold increase in mental health disorders, high rates of epilepsy, diabetes, dental problems, and environmental stressors like family poverty. Interrupting this cycle during the developmental period prevents a singular delay from evolving into a permanent cascade of lifelong impairment. To address these intersecting challenges, clinicians use a structured framework. The DSM-5 brought these conditions together into a single chapter for the first time, establishing a standard for diagnosis. One major category is intellectual disabilities. This involves a distinct pattern of intellectual skills, where a child struggles with reasoning, problem-solving, and the adaptive behaviors needed for daily life. Communication disorders form another group. These are specific deficits in how a child understands language, expresses themselves verbally, or articulates the sounds of speech. Then there is ADHD, which affects roughly 5% of children. It can present as a struggle to sustain attention, or as predominantly hyperactive and impulsive behavior. The matrix includes specific learning disorders, covering reading and mathematics impairments, and also motor disorders, which involve atypical coordination or repetitive movements like tics. Because these conditions frequently co-occur, this diagnostic system is less about applying labels and more about identifying the exact combination of support a specific child requires. Autism spectrum disorder, or ASD, illustrates how these neurodevelopmental complexities manifest. Diagnosis requires identifying persistent difficulties across 2 specific domains. The first domain is social communication and interaction. This involves challenges with socio-emotional reciprocity, nonverbal communication, and the ability to maintain relationships. In a clinical setting, we look for an unusual social approach, perhaps a child who struggles with the to and fro of conversation, avoids eye contact, or finds it difficult to understand social gestures like nodding and pointing. The second domain covers restricted and repetitive patterns of behavior. This is further divided into 4 specific subpillars of observable action. This might manifest as an extreme insistence on sameness, where even minor changes to a routine cause intense distress. We also see highly fixated interests or unusual sensory reactions, such as being overwhelmed by specific sounds or textures. Early identification allows for interventional strategies that build social participation, helping children move past the chronic misunderstanding that often accompanies an undiagnosed disorder. There is often a 2-year gap between a parent's first concern and a child receiving a diagnosis. This delay often consumes the ideal window for early intervention. To bridge this gap, we must recognize the specific chronological markers that appear early in a child's development. By 12 months, failing to respond to their name is a red flag. At 14 months, not pointing to show interest is a sign for concern. By 18 months, an absence of pretend play is another notable risk marker. Other indicators include a sudden loss of language skills, repeating words out of context, or unusual motor behaviors like hand flapping and body rocking. Extreme distress in response to specific sounds or textures should also prompt further investigation. While these behaviors aren't diagnostic on their own, they are clear indicators that a child needs a formal assessment to identify their specific interventional needs. By identifying these signs early and implementing comprehensive, family-focused support, we can accommodate the unique way these children process the world and permanently bring